My name is Merhawit Ghebrehiwet, and I am a second-year medical student at Oklahoma State University College of Osteopathic Medicine, and my presentation today is on inequities in epilepsy, a scoping review. As many people know, epilepsy is a neurological disorder with a strong presentation worldwide. 50 million people have been diagnosed internationally. In the US alone, there are 150,000 cases annually. My team and I believe it is imperative that the health inequities tied to epilepsy are assessed and accounted for. Further, it is vital that healthcare providers are familiar with such inequities to supplement appropriate care for patients. So for our objective, we intended to complete a scoping review of current literature surrounding health inequities in epilepsy, all while providing recommendations for future research. In July of 2022, we searched Medline and Ovid Embase to find published articles focusing on the subjects of epilepsy and health inequities. 2 investigators screened and data extracted in a masked duplicate manner. Studies published within the time frame of 2011 and 2021 in all countries were deemed appropriate. We evaluated the inequities of race, ethnicity, sex or gender, income, occupation status, education level, under-resourced rural, and LGBTQ. To summarize the data and descriptive statistics of our study, we used Stata 17.0 from College Station, Texas. And this Prisma flow diagram here highlights the screening and extraction process. We screened 5,325 articles for titles and abstracts alone, and then 56 articles for full text. And as you can see, we did end up with 45 included studies. So from our included studies, the most reported health inequities were income, which had 18 in frequency or 40%, geography or under-resourced rural with 15 or 33.3% of total included studies, and race ethnicity, which also had 15 or 33.3%. The least reported health inequity was LGBTQ with a frequency of 0. In conclusion, our scoping review found several gaps in health inequity research that should be addressed with future studies to facilitate more inclusive and equitable outcomes for patients with epilepsy. We found the inequity of LGBTQ along with occupation status and sex or gender to be examined the least. None of the studies in our review investigated health inequities among LGBTQ patients. Given the lack of studies in our sample, it is unknown how LGBTQ patients with epilepsy are affected by health inequities. And due to the diversity of LGBTQ populations, ensuring all healthcare providers are culturally competent and appropriately trained to treat such groups can prevent injury and enhance patient care. That being said, it is absolutely vital that future studies endeavor to fill in these determined gaps. Here are some references from the presentation. Thank you for listening, and feel free to reach out to my email with any questions. My contact information is right here on the slide. Thank you.